Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loeyball, and this week we're talking about chronic obstructive pulmonary disease. Clinical trials have opened doors to COPD medications. There's a show on HGTV called House Hunters that I watched until maybe season 5. People go to look at 3 or so houses and choose which one they want. Some houses have little front doors and lots of tiny rooms, making them feel cozy. Others have big glass double doors and an open concept plan feeling big and airy. The cozy houses have lots of furniture tucked into corners, and the open concept houses have large pieces of furniture that are sized properly for the spacious rooms. But what if a house has big open plan on the inside with narrow halls and small doors leading to it? Well, then nothing would work properly. Big rooms would have small, disproportionate furniture, and any furniture assembled indoors would be difficult to get out. This last example is like chronic obstructive pulmonary disease, or COPD. With COPD, the main passageways leading to the lungs are narrowed. This condition, called chronic bronchitis, results from chronic inflammation, scarring, and damaging the main airways. With emphysema, the inflammation damages the tiny air sacs called alveoli deep in the lungs, destroying the walls between them and opening the space. The result is lungs that have trouble filling, lungs that don't extract oxygen from the air well, or both. If COPD lungs were on House Hunters, it would be a tough sell. Chronic obstructive pulmonary disease is among the top 5 causes of death worldwide, affecting around 11% of adults over 30. The inflammation that causes COPD is stimulated by continued inhalation of tobacco smoke, dust, fumes, chemicals, and other smoke, like from wildfires or barbecuing. Risks increase with conditions that increase inflammation response or decrease lung function, such as genetics, developmental, or birth abnormalities. Signs and symptoms include persistent difficulty breathing that gets worse with time or exercise, wheezing, chronic cough, fatigue, extra mucus, weight loss, lower respiratory tract infections, and anemia, which is low red blood cells, which can reduce the ability to exercise. To top this off, inflammation, cellular damage, and lack of oxygen exchange can also damage the heart. Those with COPD have a more than doubled risk of developing major cardiovascular disease. Considering the nearly 400 million people who have COPD, it's no surprise that there have been myriad efforts to find solutions. One of the most important first steps is to reduce modifiable risks by quitting smoking, avoiding pollution, and seeking vaccines for common respiratory infections such as RSV, flu, and COVID. Back to the house analogy, inflammation is like a particularly insane neighbor going to a lifelong smoker's house and removing the yellow walls and closing the windows to keep the smell from leaking out. The better solution would be to stop the smoking in the first place and probably reporting them to the police. Beyond risk mitigation, non-pharmacological solutions include oxygen and supervised COPD exercise rehabilitation. Randomized controlled clinical trials have found that successful treatment of COPD can help with heart issues and increase lifespans. Medical solutions for COPD fall into 2 major categories: bronchodilators and anti-inflammatories. Bronchodilators make it easier to breathe either by relaxing and widening the airways or blocking the receptors that narrow and constrict the airways. Beta-2 agonist medications such as budesonide and formoterol relax and open the airways to improve lung function. The long-acting form for long-term use is called a long-acting beta-2 agonist, or LABA. Antimuscarinic medications block the receptors of the smooth muscles that constrict and narrow the airways. Long-acting muscarinic antagonists, antagonist meaning working against, medications like glycopyrrolate are abbreviated LAMA. LAMAs can act in concert with LABA medications. Individually, each medication has limited effects. In order to make sure these medications act primarily on the lungs, they are usually inhaled. These combinations may improve lung function and provide relief of symptoms like shortness of breath. While the medications improve quality of life and reduce exacerbations of COPD, there is limited clinical trial data that LABA and LAMA medications improve mortality rates. Anti-inflammatory medications can help keep that metaphorical crazy neighbor in check. Inhaled corticosteroids, or ICS, have a clinical research track record of safety and effectiveness at lowering inflammation markers like CRP in the lungs. They aren't perfect on their own. They're only limited in effectiveness and may increase the risk of infections since they lower the immune response. The obvious solution is to combine LABA, LAMA, and ICS medications. Triple therapy LABA, LAMA, ICS medications have shown better performance than dual therapy LABA, LAMA medications in randomized clinical trials. Current FDA-approved triple therapy inhalers include Trelegy Ellipta and Breztri Aerosphere. These medications are more than the sum of their parts, much like a house is more than just a pile of walls, doors, and roofs. If you are suffering from COPD, consider looking into a clinical trial for a new triple therapy medication, and with luck, you may be able to catch season 685 of House Hunters. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll see you next week.